Karen's experience at St. Joseph Hospital began when she had her right forefoot amputated as a result of her history of diabetes mellitus, peripheral vascular disease, and end-stage renal failure. Her next experience at St. Joseph resulted in further amputation. Initially, her left leg was amputated below the knee, but complications led to amputation above the knee. After Karen was transferred to the continuing care hospital at St. Joseph East, she developed a clot that required treatment. Finally, she and her husband were able to return home. Most recently, Karen arrived at St. Joseph Hospital with pain in her lower right leg. In the operating room, doctors saw that she needed a right knee disarticulation. Toward the end of the surgery, Karen had an episode of electromechanical dissociation and was found to have 3-vessel coronary artery disease. The doctors would not operate on her heart due to her comorbidities. Our nurses came to know Karen well, especially Alicia. Alicia learned that Karen's prolonged hospital stay had interrupted her plans to renew her wedding vows with her husband. Their pastor arranged to come to the hospital for the ceremony. Without Karen's knowledge, the staff on her unit put their heads, hearts, and hands together to arrange a setting fitting for such an event. After completing a 12-hour shift, Alicia shopped for supplies, including a white gown on which she sewed pearls and sequins. On the day of the ceremony, as soon as Karen left for her routine trip to dialysis, the staff began to decorate her room with romantic lights and netting. A reception table was set up with food and a small wedding cake. When Karen saw her room, she was overcome with emotion. Quickly, the staff dressed her in the white gown, fixed her hair, and applied a little makeup. During the ceremony, everyone shed a tear, including staff members and even a few people who were just passing by. Karen said she was certain God had a special place for all the angels who work on the 3A post-op surgery unit. She said the vows renewal ceremony they arranged was nicer than her wedding. As she looked at a remembrance plate that the staff had signed, her eyes filled with tears once again.